All right, good morning, everyone. Here we are at Workshop 3. It's incredibly exciting to be here with you. And I'd like to just add my thanks to everyone for coming, because this is a culmination point of a journey, and it only will be successful with you in the room. We've done a lot of work. We had like a rehearsal dinner last night of the planning committee and some of us, and this is our wedding in some sense. So, and you're all invited, and it's a participatory wedding. This is a journey and a process, so I thank you each. We will not be doing, you notice the size of the room. We could have introductions and then lunch if we all went around, and then we all did our full bios. I think we'd end the meeting with our introductions. So all of the bios are in the materials. And as you look at it, we tried to bring together a diverse group of individuals who are working in this space at different levels and bring different perspectives intentionally. And we ask you to bring your full selves today, because this workshop will work well with your participation, your active participation. And we really want to hear where the planning committee and the research has gotten it right, where we're off base, and what we've missed. Because we're a group of people who've been working at this for the last 18 months, but we're a group of people who are thinking about it. There are many other thoughts and many other things happening. And what's been exciting is this field, for all of you who are working it, is an emergent field. When we started, I think there are fewer models. There's more evidence now happening. There are initiatives happening at the federal and state level. So in some sense, it's hard to keep up with all the action, which is a great problem to have if you're a National Academy of Medicine. If you're in a line of work that is so dynamic, that it's changing every week, changing every month. So we welcome what you're learning, what you're hearing, what you're seeing, and how what we're proposing, how does it feel to you? And I also would like to thank the planning committee. I think planning committee here is a misnomer. It was a work group. And for those of you who signed up for it, thank you to each of you for saying yes to all of the things. And you'll hear later that not only at the workshops where we're doing work, we had subcommittees and subcommittees working and folks working on different issues, that you'll hear some of our thinking today. So I just want to acknowledge the effort and the spirit of the group, because I think there was a camaraderie that I hope comes through today. So we have 3 objectives. If you've seen on the agenda, we have 3 objectives today, and it matches what Michael and Jeff have said. The first is to examine tools to improve care delivery for high-needs patients. So and let me back up one step. Our charge as a committee is to start at the human level. And you'll notice we'll start the workshop at the human level with people who are delivering care, who are at the front lines to hear, and all of our work needs to be grounded in that. In previous workshops, we've had patients come and share their experience, share their aspirations and expectations. So all of our work as a group has been grounded in the realities of individuals on the ground. So first, examining tools. So what are the tools that work for those high-need patients? Second, what's the policy agenda to better support it? Because oftentimes what we found, I'll give you the headline before we get to the day, oftentimes we found heroic efforts around the country that have been successful in spite of the policy and financing arrangements of our healthcare system. And so one of the second objective of this meeting is to find what are those policy objectives and policy opportunities that would support the programs that are successful. And then third, this is meant to be action-oriented. We will produce a report, so don't worry, there'll be a report, but it's meant to drive action. So we're looking to synthesize and identify future opportunities. So this is not just a distillation of what we've learned and where we are today. One of our charges today is how do we move forward, both the individuals in this room and how do we set others who are working on these issues up for success. So those are the 3, I think, clear objectives, and you can see that we've organized the agenda to match those. As I mentioned, we'll start with a patient perspective and caregivers, and we found that to be immensely valuable to make sure that we are not solving the wrong problem, and that we're not providing health care to or for people. We're actually providing care with people, and it's co-created and co-designed. So I'm excited, as Jeff is, with that, and I'm very thankful to our panel, to Eric, Veronica, and Gretchen for coming. We appreciate your participation. And then we're going to look at the patient taxonomy and promising care models. And what we think is an interesting contribution is the intersection between how do you segment a very diverse or heterogeneous high needs population and then what are those tools that work for different populations, and how do you start to put those together? That can drive an action agenda. So we're going to hear from our colleagues Melinda Abrams and Arnie Milstein on the intersection between those and how you would take several tools and then put them into use and what that could look like. After a break, we will hear about policy opportunities from my colleague David Blumenthal, Jerry Anderson, and Catherine Hayes. And that's what we've tried to do here is at the federal level, at the state level, within the private sector, there are a number of things that are holding us back. And there's a number of opportunities. So what we'd like to do is an examination, and it's as part of the partnership. The Bipartisan Policy Center hosted an event last month looking specifically at Medicare and Medicaid interactions, heavily on Medicare for high-need seniors. And so Catherine will share some of that work and how they're moving it forward. Jerry will take it to everything else as his, but looking, because I think that Medicare is one important player and the federal government is actually a very important player. There are a lot of other opportunities and policy opportunities that we think are incredibly important. And then importantly, we have a reactor panel. So what do you think about those? Did we get it right? Where were we right? Where were we wrong in terms of some of these policy opportunities? And where would you prioritize them? How would you think about them first, second, and third? We'll then have lunch. During lunch, we will not have a speaker. It's a chance for you all to interact. We'll reflect on the morning and talk at your table with what you've learned, what you've seen, and we welcome your feedback there as well. And there are planning committee members at each of the tables to listen and to seed that conversation. And then as a health services researcher, my favorite part, other than the patients and the caregivers, which I love, but the health services researcher in me is very excited about metrics in the afternoon. So much of this work and the move from volume paying for services to paying for value or outcomes for high needs patients requires a robust, credible, replicable measurement system and data and things. So we'll have an expert panel to begin to lay out what that could and should look like. We'll then synthesize in the afternoon and then end with the discussion. I think that we put on the agenda tightly moderated discussion, which is an opportunity with my colleague David Myers, to have your input on what do you take away from today, what resonates with you, how could we move this forward, what are some of those opportunities, whether it's for the philanthropic community, in federal policy, state policy, in action in the field. So we've created an environment so that the landscape is broad. What we're looking for in the group is where and how should we move forward. So that's the gist of the day. We'd love to come out of here with some clarity. Right? Clarity and if we can come out of here with momentum and consensus, that would be great. But we really are seeking your feedback, and we've structured each of the sessions to have some input. We will not filibuster and take up the entire time. What we are looking for is your interaction, your questions and things, and we'll provide ample opportunity to do that. A couple of housekeeping, and then I will step aside and we'll get on with the show. Slides will be available after the meeting. We need to check with each of the presenters to make sure that they're okay with that, but we will present slides after the meeting. It is being webcast, the meeting. Hello, all of our webcast folks who are watching online. And the webcast will be available after the workshop online to those who are interested. And then if you'd like to speak, use the standard National Academy of Medicine format, which is turn your table tent up. And we have microphones on each table. So if you just turn your table tent on the side, it will indicate that you'd like to have a comment or a question. So with that, I think we are ready to get started. It is my distinct privilege to introduce three individuals who are living this every day and working with and serving high needs patients here in DC. They will give us the patient perspective and a caregiver perspective, because I think you can't have, with a high needs population, there's not a single patient perspective. It is also the care team and the caregivers who are actually providing their needs, not just their healthcare needs, but their social needs, their all emotional needs and things like that. So I'd like to welcome Eric DeYoung from MedStar Total Elder Care, Veronica Humes-Butler, a long-term caregiver, and Gretchen Nordstrom from MedStar Total Elder Care to come forward and share their perspective to kick off the day. Thank you.